In traditional Thai massage, you'd start at the person's feet. Now, he comes in and says, I have upper back and neck pain. And I go, okay. How does he feel?
Like you didn't listen.
And that really sets up some of the weird, like, cultural components I had to deal with trying to understand what is it we're trying to do and why, and then how do we package it and sell it. So if I don't come up and I say, listen, you're having problems with the upper back and neck, is it right here? As soon as I touch that, the client feels like I heard them, I listened to them, and they cool out. So I go, listen, like, what do you do for work? And I don't do that for just small talk to find out he's a bank teller. I usually do this because I'm trying to find out what position he's holding his body on a daily basis. You see all this jostling and movement? Yeah. I'm able to get his shoulder blade to fall open. Most people's shoulder blades are simply glued onto their rib cage. The shoulder blade does not, like, roll back and open, right? Stuck all the time, all the time. I will come in and usually mobilize, touch that area, find out if in fact that is where it is. Sometimes they'll say, no, it's a little higher. Sometimes they'll say, no, it's up here. I'm just going to work with them, touch the area they're having a problem with.
Yeah.
How's that right there? Good, all right. Because now I've got a good handle. Even though my fingers, I have two fingers that are stacked in between his shoulder blade and his spine. I'm just working the paraspinals. I'm putting pressure where, they feel pain there. But here's what I'm really doing. I'm trying to get his shoulder blade to unwind, release, open up his pec minor. If I'm working on a woman, we're clothed, her breast tissue's falling forward, no issues. Now, it's more physically intimate because I am butting against the person, but once I start to do this, does he feel his neck? Mm-hmm. Does he feel his shoulder blade? Does he feel his pecs? Yeah. Do I get to move the shoulder blade around? Now, I can't do that from prone, or at least not as easily. Make sense? Mm-hmm. So I can use my fingers. I can hook into supraspinatus. I can hook into the traps. I can hook into levator scapula. I'm not going to overwork my fingers here, by the way. I'm just kind of feeling my way around, seeing what may be tense. When I lift him, see how his neck comes along with me? A little tight there, maybe? Mm-hmm. Now, I'm not making a judgment on the person I'm working on. I'm just trying to see what may be going on as I move them around. Sometimes you'll hit a segment of their spine, it's completely mobile, moves really easily, and then all of a sudden, what do you hit? Creaky. Like it's just stuck. It seems like the tissue is kind of locked down around it, right? Pressure's okay? Yeah. There we go. Now, I can pull down towards his hip. I can also pull back and away. My thigh is here stacking, so I can actually just start to almost pull him over my thigh. How's that?
Good.
There we go. Sometimes their head will just roll over my leg. Doesn't bother me at all. How does this feel?
Nice.
Yeah. Now, is it relaxing?
A little bit.
Is it spa?
No, it's not spa.
Is it clinical? Is it medical? And that's what I want you to think about from a marketing standpoint. I don't think clients really care as long as you help address what they're coming in for. So when the people come in for relaxation, do they also have pain stuff?
Yes.
Yeah. And some don't know. And that's where you have to educate. You have to have an understanding not only of our art, but the marketing process and like consumer expectations.